Welcome everyone to week 5. The first lecture in this section is going to discuss culture and health. And I know you have touched on cultural sensitivity in previous classes, and I'm just coming at it from a different perspective, from a global health perspective and working in developing countries. So I know you understand the importance of culture to health and that it is a very important determinant of health. And so culture is related to health behaviors. Culture is a really important determinant of people's perceptions of illness, perceptions of disease. Culture affects the usage of our health services, and different cultures have different health practices. And I know you've seen this, and I know you've talked about this already. But from our perspective, we're going to look at it from culture influencing health and how you, as someone going into a vulnerable community or working with a vulnerable population or working in a developed country, how you work with a culture to improve health practices. So some examples that the textbook discusses right up front are that there are some cultures that put a strong emphasis on monogamy in marriage because it's proven to decrease the HIV transmission. But there are some cultures that having concurrent sexual partners is very common. Another cultural preference is in some countries, cultural heaviness, so being a little bit more overweight or being obese means that it's a sign of prosperity or wealth. But we know that our obesity crisis increases our risk for diabetes and for heart disease. Other cultures have certain taboos against pregnant women eating certain foods during pregnancy. So therefore, they may not be getting all the nutrients that they need for their pregnancy and for their unborn child. And so these are some of the cultural issues that you may come up against as a healthcare provider. So as we consider the relationship between culture and health, we need to be aware that a culture is viewed by people from outside that cultural group. And this helps us to understand the differences that we see from an individual looking in at another culture from their perspective, and from those individuals from inside that culture that live with that culture and their perspective. And that's where we get into ethnocentric. So that's meaning thinking that your culture is better than the other culture or is the norm. And where we want you to kind of switch your point of view is to look at cultural relativism. And so cultural relativism is more looking at the idea that cultures are unique and that they can only be evaluated according to their own standards and values. And so you really do need to understand that culture's perspective to understand their perceptions of health. And I see this constantly in my work in Ghana, is that I need to understand their culture, how they understand health, why they do certain things. I can't come in with my Western beliefs and values. So it's very important for me to culture is very huge when we're making any type of decision making with respect to health in the communities that we work in. So one of the big questions that you can ask yourself when you're working with different cultures from a healthcare perspective is how well does a given culture satisfy the physical and psychological needs of those whose behavior it guides? The textbook gives some really interesting examples. So for example, is female circumcision, also called female genital mutilation, a health enhancing procedure or a harmful procedure? Is it good or bad for the health of a newborn to be given sugar water, as in some cultures would do that? How should one see cultural practices that discriminate against women and cause them to eat less well than men in India or China? How should one see cultural practices that discriminate against sexual minorities? And so some of the areas that I've come up against is the top picture here is a young girl who in Ghana is called the water girl. She doesn't go to school. Her job is solely to go and fetch the water for her family. Another one is WHO is pushing medical male circumcision in certain countries because it is shown to decrease the transmission rates of HIV. And so, again, understanding the importance of recognizing different perspectives of culture and how it influences health. And so I thought this was a great quote that I took from the book. Those responsible for guiding health policies and programs in different countries must have a good understanding of the cultures with which they are working. So the textbook goes on to discuss other key concepts and definitions. And so if you look at page 168, it goes through topics that you've probably already discussed in other classes. It looks at cultural competence. It looks at the concept of cultural humility, health literacy, what's traditional medicine, and how Western biomedicine is completely different than traditional medicine. And you can see that, there could be some conflicting, or actually there are conflicting opinions with respect to traditional medicine and Western biomedicine. And when working in different countries, you need to be cognizant of those different points of view and different perspectives. I want to speak and move on to a little bit about health beliefs and practices. So as you've learned, different cultures vary in their perceptions of the body and their views of what illness is, what disease is, what causes illness, and what should be done about it. And different cultures have different views on how to prevent health problems. What health care should they seek, and the types of remedies that health providers might offer. And so what I want to speak to is just some of these key ideas. So perceptions of illness. For many different cultures, illness is a personal, interpersonal, and cultural reaction to disease or discomfort. It varies across groups, and one culture may view certain signs or symptoms as an affliction, while others consider them normal. And so some of the examples they give in the book is that there's a very common illness in Egypt called schistosomiasis. And it causes blood in the urine, which is referred in Egypt as male menstruation. And so it's considered normal. But for us, if we saw urine or bloody urine in a man, we would consider that a true urinary problem, that there's something going on with their urinary system. And so, again, the difference is perceptions of illness. Perceptions of disease. So for the majority of us, we would say that, I'm not going to say majority of us, from the biomedical perspective, disease to us is a malfunctioning or maladaptation of biologic and psychological processes in the individual. So it's coming from a very science perspective. But some cultures believe that illness is caused by emotional stress, supernatural causes, body imbalance, they've done something wrong. They've done something wrong to affect the gods, and the gods are punishing them. And so it's very important to understand those different perceptions of disease. Another area of health belief and practices are folk illnesses. So folk illnesses are, it's a perception from a culture. So it's a cultural interpretation of a physical state that people perceive to be an illness. But from a biomedical perspective, we do not see a physiological cause. And so it's really important to understand that health problems in other cultures and in other societies may be folk illnesses. And so we may see that this has no biomedical basis, but the culture believes that it's important. And so any efforts to improve the health of the community will have to consider these beliefs. And so the textbook gives a good example of an illness, a folk illness in Latin America, which is called empacho, which is a condition that's caused by food that gets stuck to the walls of the stomach or intestines, causing an obstruction. But from our biomedical perspective, we're not seeing any physiological cause. But you can't discount individuals because you need to be culturally sensitive to their culture and what they feel illness is to them. So as you can imagine, there are many different perceptions of illness, so there would be many different perceptions of how to prevent illness. And so many cultures have taboos or behaviors and practices that they forbid people from engaging in if they are to stay healthy. Many of the taboos are concerned with what women should eat during pregnancy and what they should not be doing during pregnancy. And so there's a wide variety of ritual practices to avoid illness. The textbook gives a couple of examples that babies are to be given sweet foods so they would not be weak, so giving sugar water. Eggs are given so that the baby would not grow up to be a thief. And so there's many of these health beliefs and practices. And again, as your perspective, you need to understand these rituals. The last part I want to talk to with respect to health beliefs and practices is the diagnosis and treatment of illness and the use of different health services. So in many cultures, developing and developed countries, when people are ill, they first try to care for themselves by themselves. Maybe they get help from a family member. Maybe they use a home remedy. In many developing countries, they may next go to a local healer to use some of their indigenous medicines. And only when the illness doesn't get resolved do they seek actually a Western doctor, if they have access to a Western doctor. And so the textbook talks about the manner in which people and families care for illness is called the pattern of, or the patterns of resort, and that people seek help from different healthcare providers at different times for a number of reasons. One of the important reasons is the cost of the service. The other could be the manner in which the local healer treats them socially, and maybe they understand their language. They are known to them. They are treated, the individual feel like they're treated with respect rather than going to an outsider where they feel that maybe they're being disrespected. So there's a number of reasons why individuals will first use home remedies, indigenous healers, and then eventually go to biomedicine or looking for a Western medicine model. So now that you've studied the burden of disease and risk factors, you can see how many of these leading causes of disabilities and deaths are all related to health behaviors, which in turn are often related to culture. And so there are many behaviors that are conducive to health, no doubt. But the important question is to ask is, what are the behaviors that contribute to the leading risk factors for illness and premature death from a cultural perspective? And the book outlines some really important ones. The first one is nutrition and eating practices. So an infant being underweight for age is really an important risk factor for premature death in low middle income countries for children and women. Many cultures have food taboos for pregnant women that are not helpful to birth outcomes. How much women breastfeed their babies is closely linked with culture, as is the timing for the introduction of the complementary foods, when to introduce them, the types of foods that are introduced. And undernutrition also stems from other eating practices that are closely tied to culture. Another one is unsafe sex. So we know that unsafe sex, or not using condoms or having multiple partners, is a major risk factor for HIV in low, middle, and high income countries. And some people who are working in the sex trade may not have the bargaining power with their clients to negotiate whether a condom is going to be used. A lot of women in different countries or different cultures are forced into unsafe sex by their husbands and boyfriends because of their disadvantaged economic position. And so many people who engage in unsafe sex do not have the control over whether or not they're able to use a condom. And so what would it take to ensure that people use protection? Again, this is a cultural perspective. Hygiene is another area related to health behaviors. And so a lot of cultures in developing countries have a lack of safe water and sanitation, and it's a major risk factor for diarrheal disease. And so how do we teach different hygiene practices to individuals that are in those situations. And so behaviors regarding hygiene are intimately linked with culture and how can they be changed. Tobacco smoking is a leading risk factor for cardiovascular disease and cancer. We see this in low, middle, and high income countries. And so, are there measures that can be taken to change this behavior? Could we look at trying to change the behavior in adolescents? And that's what we're doing in our higher income countries. Can we look at that in our low middle income countries to try and stop adolescents from taking up smoking at an earlier age? And so these are all ways or things to think about, is how can unhealthy behaviors be changed, but taking culture into perspective. So now that we're talking about health behaviors and behavioral change, how can you as a healthcare provider, possibly coming from a different culture, improve health behaviors in individuals? So the textbook briefly goes through 4 different models or theories that explain maybe why people engage in certain health behaviors and what can be done to encourage change in health behaviors. So I'm just going to briefly look at these. So the ecological perspective, basically it's looking at an individual not just solely from their individual level, but looking a lot broader. And so it's looking at those social determinants of health, and that health-related behaviors are affected by multiple different levels of influence. And so the individual, interpersonal, community, what's the public policy? And that behavior both influences and is influenced by the social environments in which they occur. And so it's very important to take a step back and look at those social influences. So the ecological perspective from the textbook looks at the different factors that influence health behaviors. So you can see here the individual, their individual characteristics, their attitudes, belief, personality traits. They're interpersonal, so who are their cultural group? Who are the individuals in their family, friends, and peer group? Institutional gets into more upstream, looking at policies and regulations. The community, what is the community like that they live in? What's the social networks and the norms within that community? And then even higher up are those public policies. So that's the ecological perspective. The next model is the health belief model. And the health belief model believes that health behaviors depend on certain conditions or certain perceptions. So an individual's perception of their likelihood of getting the illness, the severity of the illness, the benefits of engaging in behaviors that prevent the illness, and barriers to engaging in preventative behaviors. And in the health belief model, people's health behavior also depends on whether or not people feel that they could actually carry out the appropriate health behavior or making a change. And that's called self-efficacy. So the textbook gives a really good example of HIV and engaging in safe sex. And they provide an example of whether a young man will choose to use a condom will be influenced by 1, how easy he thinks it is to become infected with HIV, 2, how serious a disease he believes it to be, the extent to which a condom can prevent HIV, and how easy is it to buy a condom and get a partner to agree to use it. And so again, that self-efficacy is that depends whether or not the people feel that they could actually carry out the appropriate behavior and make that behavioral change. So for me and my work in Ghana, I feel that our group or our NGO uses more the perspective of the ecological perspective. So looking at what influences an individual's health, and we look at the health belief model. Is it easy to make that health change? The other models you will remember from leadership. So the stages of change model, and this is how you go about making a change. So change is a process and different people are at different stages of the process, and that there are specific stages of behavioral change. So pre-contemplation, contemplation, making the decision to change, doing the action, and then maintaining it. And then the last model that you will remember from leadership course is the diffusions of innovations model. And so this model is based on the notion that communication is needed to promote social change, and that this so-called diffusion is the process by which innovations are communicated over time among members of different groups and societies. And so this model focuses on how people adopt innovation, but not really how they might maintain what they have adopted. So that's kind of one of the downfalls. So you can clearly see that if we want to improve the health status of individuals, we need to look at the behaviors of themselves, of the individual, of their families, of their social groups and their communities, and really all that needs to be changed. And it ultimately is connected back to culture, which is very difficult to change. And so when you think about it under these circumstances, what can be done first is that we need to understand what behaviors need to be changed, and second, how do we change them? And so understanding of behaviors requires that we first understand the behaviors that are taking place, the extent to which they enable better health or do they harm health. Is there an underlying motivation for these behaviors? And what is the likely response to different approaches to changing the unhealthy behaviors? So this was definitely an assessment that we undertook with with my NGO that I travel with, is looking at how do we promote the exclusive breastfeeding for 6 months that WHO recommends to decrease child mortality rates. Because when complementary food is introduced too early, we're finding that babies become dehydrated. They become sick because maybe the food that's been introduced is contaminated with impure water, or there may be a sanitation issue, and that these young neonates, these young babies, just can't tolerate diarrhea and dehydration that comes from diarrhea, and that if we push exclusive breastfeeding, we can increase the life expectancy, we can increase, or more so decrease, the child mortality rates. And so we need to understand that why is it that complementary foods are introduced early? Why are these behaviors taking place? What is their perspective on breastfeeding for 6 months versus not? And so it's very important for us to understand the whole picture from a cultural perspective. So how do we go about changing health behaviors? So there are many different approaches to changing health behaviors. Some are at the level of the individual, some are at the level of the community, and some of them are more upstream, looking at the society as a whole. So these are some of the examples that can be used, and some of the ones that we've used in Northern Ghana. So one that we use for sure is community mobilization. And so that's engaging an entire community in efforts to identify problems and promote healthy behaviors. We tend to focus in on specific leaders in the community. So say, for example, if we want to promote exclusive breastfeeding, we would focus in on mothers in the villages that we have encouraged to exclusively breastfeed, and that she's able to explain the benefits from her perspective. We look at the elderly women in the communities because they are seen as the leaders in the community. We look to the chief in the community. We discuss with the pastors in the community. So it's really looking at who are those leaders in the community that need to be mobilized, that are willing to champion the change. Mass media. So this is looking at using a source of radio. So we do this as well. So most people in low middle income countries do have access to a radio. And so promoting health behaviors through that route. In our developed countries, social media and social marketing is really important. Health education, we do this quite a bit in Northern Ghana, is that we will go into the school system and provide education programs to our young group of individuals, or our young students in Northern Ghana. Conditional cash transfers, we have definitely used this. The one program that we've used giving money as an incentive are for young mothers who are pregnant to ensure that they go to a health facility to give birth, and to not give birth in the village. And so we have set up this program that if parents are want to be part of this program, we give them an incentive. We give them a small box with a donation to their newborn child, with the premise that they will engage in certain healthy behaviors. One being that the mother will definitely go to a healthcare facility to give birth. The mother is willing to be followed by a community health worker before birth and after birth, and we try and push the importance of breastfeeding for 6 months. And so these are all ways to achieve success in health promotion. So I'm sure you've learned about this in your community course, the importance of a social assessment, and that connects the links between health and culture. So social assessment is a process for assessing the social impacts of your interventions or events, and for developing strategies for the ongoing monitoring and management of those impacts. And when you're doing your social assessment, obviously it's very important to involve the affected communities in the design and implementation of the assessment and its follow-up. And so one of the areas that we've looked at this is, again, remember I've told you about the LIATA program, where concerned mothers in the community came forth and identified that there was a high rate of maternal death and a high rate of infant mortality. And it was identified that what we needed to do was provide resuscitation techniques for when a baby is born to a mother in a village, and train community health workers to be able to resuscitate a baby. So that was kind of the social assessment. We did a whole assessment of why this was happening. So what are the main messages? That culture is an important determinant of health, that there are perceptions of illnesses and disease that vary considerably across cultures. There's many forms of traditional behavior that are conducive to good health, but some are not. And it's important to consider how healthy behaviors can be promoted. There are a number of models of how behaviors can be changed. Several approaches are often important to changing behavior, so several different models, and the importance of conducting social assessments as an effective tool for setting the foundation for health efforts and behavioral change. Thanks for listening.